الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. This is another short case presentation. As we see here in the sagittal view of the knee joint, and the sequence is proton density. Is this X-ray, is this MRI view is normal or abnormal? Look at it and tell me it is normal or abnormal. As we see here, this is a normal knee MRI. And we see here, we see the posterior cruciate ligament. And this is part of the anterior cruciate ligament. The posterior cruciate ligament is extend from the medial femoral condyle to the posterior intercondylar space of the tibial plateau, and its function is to resist the anterior translation of the femur. But we see something else. Here we have small rounded structure behind the posterior cruciate ligament. And this is the meniscofemoral ligament. And it is also known as ligament of Wrisberg. If we see it is in the posterior part of the posterior cruciate ligament, it is called ligament of Wrisberg. Sometimes we see it in the anterior cruciate, anterior to the posterior cruciate ligament in this area, and this portion of the anterior meniscofemoral ligament, it is called Humphrey ligament. And this is a normal variant. Either Wrisberg ligament or Humphrey ligament can present either in about 70% of the knee MRI. And in other words, in about 70% of knee MRI, there is either anterior meniscofemoral ligament of Humphrey or posterior meniscofemoral ligament of Wrisberg. But in about 6% of knee MRI, both the anterior part of the meniscofemoral ligament and the posterior part of the meniscofemoral ligament are seen. Thank you for listening and hoping to see you soon for another talk. سبحانك اللهم وبحمدك استغفرك واتوب اليك.